global pandemic has been ongoing, but life has continued. We've been delivering patients, we've been delivering babies throughout the entire time, and we've been doing it safely and effectively, creating access to care, access to appointments, and an opportunity to continue the dialogue to move health forward.
When a pregnant woman comes to Rush, I think one of the first things she can expect is that we will be evaluating and screening for COVID-like symptoms. Sometimes that can happen initially, even before they reach the building, from a phone call the day before their appointment by one of our support staff to ask them, have you had headaches? Have you had any fevers, chills, any of the COVID-like symptoms? In addition, when they come into the building, usually they'll have their temperature taken and they'll again be asked those similar type questions. This is done just so that we can identify early on any patients that may have any symptoms that we can then perhaps direct to getting the COVID test versus bringing them into the clinic and exposing our staff or other patients.
In order to keep our staff safe and our patients even safer, we've limited the number of visitors to our clinic. So if you're routinely getting an ultrasound that would require you to be in a closed room with an ultrasonographer for an extended length of time, we're not allowing visitors in that situation. But we've learned to become creative. We have FaceTime, we have Zoom, we have all sorts of options that allow people to become a part of the experience without actually being there. And I think this has become a lesson for all of us. How do we stay connected in a global pandemic through the most important events of each other's lives?
It also opens the door for partners who perhaps traditionally couldn't be there to kind of take 5 minutes from their job and call in and be able to be part of the visit. We've also instituted a lot of workflows to not only be able to identify, isolate, and treat our COVID positive patients, and at the same time be able to protect the healthy patients.
So when we talk about safety on labor and delivery, and when our patients are coming to deliver, we have to talk about the safety of the whole family.
Currently, our policy is that a pregnant woman entering in through triage who might be coming in labor, if they're deemed that they're going to stay in, so initially they'll be coming in on their own. We don't allow any visitors within triage, again, for that same limiting of exposure. But once they're in triage and they're evaluated, if you're deemed that you are indeed in labor and you're going to be admitted, then we do a point of care testing. Point of care testing will let us know within 5 to 10 minutes whether or not you are positive. And if you're not positive, then you will be allowed a support person, your partner, your mother, father, whoever that might be for you. In addition, you are allowed to have a doula. If you do test positive, then you would not be allowed a partner to be there with you. In those cases, we do have monitors that partners can kind of call in and be there virtually. We have an amazing nursing staff and providers that are there to kind of help support patients. Every time I hear that, oh, you'll be delivering alone, I kind of cringe at that because that's never the case. You will be delivering with a team of experienced, supportive staff that will be with you throughout the entire process.
If you're having a scheduled cesarean section surgery, you will be tested just like in any other surgery for your COVID status. When your COVID testing takes place, it doesn't mean we change our care. It just means we change our approach with the goal of having you have the best and healthiest experience for you and your child. We continue our safety measures from just the very beginning in our appointments to our admission, to the delivery unit, to our postpartum experience. In each situation, what is of the utmost priority is our patient's safety, the safety of the patient, the visitor, and the staff.
You'll have the nursing staff, consultations for a lactation consultant, the doctors or nurses that'll be rounding on you and seeing you as a patient. All of our nurses are trained in breastfeeding. We do skin to skin right away at the time of delivery. So once a baby is delivered, we put the baby right on mom's chest to promote bonding, and that has also improved our outcomes in terms of breastfeeding.
Rush has a baby-friendly designation. That means under all circumstances, we prioritize allowing the mother and the family to be with their infant. This has persisted throughout COVID. We have been mindful of testing.
We have had all that time to really establish those workflows to identify, isolate, and treat our COVID patients, and in that same manner being able to keep our other patients safe. Sometimes it's a little scary for patients, sometimes the visitor restrictions are a bit concerning, but I think it's all with the intention of keeping everybody safe, whether that's our staff, our patients, and we've been doing a great job of that.
We're here, we're available. And what we've learned is that your self-care is just as important as everybody else's care during this time. Rush is here for you, and Rush is a safe place to get that care.